What is chemotherapy induced peripheral neuropathy and how can I manage it? My name is Neat Physio and I'm a physio who specialises in cancer, but today's video is really applicable to anybody who gets tingling, pins and needles or numbness to their hands or their feet, because that's what this word is. So peripheral neuropathy is just a very fancy word for the nerves to the peripherals, so the limbs, so the areas furthest away from the body, getting some kind of nerve damage, and then that causes tingling, pins and needles and numbness. Now, the term chemotherapy induced peripheral neuropathy is a common term used for individuals who go through intravenous treatment, and that could be chemotherapy, it could be immunotherapy, it could be targeted therapy. And the reason being is when someone has a global drug, so a drug that affects their whole body, then the whole body will have some kind of response, and all our cells are different. And fast-growing cells often get the most impact because they regenerate and they keep getting kind of loaded with that toxin, so we see more significant side effects. And for example, the hair is a fast-growing cell, so you may find that the hair that comes through starts to become a bit brittle or changes in texture. Your nails are very much the same, so you may find that thins, and your taste can also be fast-growing. So you may find that your taste diminishes or the flavour's quite off when you're trying certain foods that you used to enjoy. And the nerves are very much the same thing. They're fast-growing, but they also really rely on blood and oxygen supply to function. So when we're taking this global drug, the body's demanding so much more of itself. Our immune system has to work harder, and our body's utilisation of blood and oxygen is going to be used more sparingly because it's trying to obviously combat what the drug is doing to our body. So often the limbs furthest away, being the hands and the feet, end up getting less blood and oxygen supply, more nerve damage, and then people get those symptoms. Now, before I continue, I just want to say that everyone has their own medical history, social history, treatment program. So the advice I give is universal, it's general, and it's safe and suitable for most individuals. But you should always speak with a medical professional to let them know you've got these symptoms, because there may be other underlying causes, but also there may be other treatments available. For example, an individual who's on chemotherapy and you're still having treatment for a while, the doctors may choose to change the amount that you have or the strength of the dose so that the symptoms aren't going to get worse, because what we don't want is long-term nerve damage if we can help it. The other reason is there are other causes, so certain heart conditions, things like diabetes, there's many conditions that may cause peripheral neuropathy anyway or contribute. So if we don't look at those causes, we may not see drastic improvements in symptoms. So now that you know what peripheral neuropathy is and what possible things may contribute, how can we actually manage it? So first of all, I'm going to cover the exercises for the feet, then we'll go on to the hands, and then we'll just talk about what you can do with regards to discussions with your GP and your doctors. So all you need is really a couple of simple bits of equipment, nothing major. A towel will do, a ball will do, but basically the nature of our nerves is, as I said, they require a lot of oxygen and blood supply. Now, our nerves are amazing structures in that we've got different receptors. We've got receptors for different types of textures, different pressures, different temperatures. So what we want to do is stimulate those receptors to encourage blood and oxygen to focus on the area. Basically, you're telling your body, this area is damaged, heal it. It's very simple, but what that's going to do is flood new blood and oxygen and allow things to heal as best possible. Now, some nerves may be damaged beyond repair, but it's trying to make things as good as possible. And we do know that looking at the research that most individuals see a significant improvement, if not resolution, but it can take time. And the research seems to suggest that we have about a 2-year window to get things as good as we can. So if you're going through treatment noticing symptoms, we've got quite a bit of time to improve things. But if you're somebody who's had these symptoms for 5 years, I would still try these exercises, but it's just understanding that your body has now kind of treated that as its new normal. So trying to change anything is going to be an awful lot harder. So for the foot specifically, often it is one of the last things to improve because it is absolutely the furthest away from the heart. And also we do put a lot of miles through our feet, so they do they're inflammatory, they suffer, there's swelling, there's all sorts of factors that limit that blood supply, limit that oxygen, so it will just be slower. Now, these exercises are incredibly simple, but the advice is to do it little and often. What I mean by that is if you're really, really serious and you want to get things better, for the first month, so 4 weeks, I would be doing something at least 4 times a day, if not something every hour. But it doesn't mean very much. You could do 30 seconds every hour. So it's really looking at what fits into your lifestyle. But all these exercises you can do at work, you can do at home, whenever. So the first thing you're going to do is just have something to try and roll the bottom of your foot. So dropping a towel on the floor whilst you're doing your teeth and trying to scrunch that towel. You will find different textures useful here. So using a thick towel, a thin towel, a face cloth, really different thickness, different texture. So again, we're getting those different nerves to fire. The second thing you can do is get something to roll on the bottom of your foot. So it could be a ball, a children's toy, a dog ball, doesn't really matter. I would just have something sat where you work and just little and often roll the bottom of your foot with said object. And again, there's no harm in mixing and matching. So maybe having a spiky ball, a soft ball, a frozen water bottle, mixing and matching, because again, we're trying to stimulate those different receptors. The third exercise is very, very simple, and you can do this at your bathroom sink whilst your kettle's boiling. Hold onto a worktop if you need, but all you're going to do is go up onto your tips of your toes. Now, you don't need to do a ton. I would kind of do 5 to 10, but again, little and often, and really think about how your foot feels whilst you're doing it. Feel that sensation through the ball and the heel of your foot, and over time, try and not hold on, because you will have found that your balance is slightly off, and this is going to help work your receptors that give you balance. And then the final one, I'm just showing you with my socks off, but you can do this with socks on, shoes on. Doesn't really matter at all, but all you're going to try and do is separate your toes, squish them together. Separate your toes, squish them together. Now, this is way, way harder than it looks. Even somebody without neuropathy is going to find this hard if you don't practice foot mechanics, because we by nature try and get a bit lazy, use less muscles, and then our ability to isolate each joint gets less efficient. But again, you just do 5 to 10, open and close, and slowly find that sensation improve. Now let's move on to your hands. And again, it's very, very similar, really simple exercises. Same advice applies for the first month, as often as you can in the day. Let's get that blood flow. Let's make your body think this is a new acute injury. And then over time, we can wean as symptoms improve. The first exercise, much like the toe, we're going to try and scrunch something. So get a towel, a ball, doesn't really matter, but squish, let go. Second exercise is again very similar to one of the feet exercises. It's trying to open and close your fingers. Nice and steady, open and close. Really, really easy. And then the final exercise is trying to fold your fingers down and back up. This one's harder than it looks. Again, it's very similar to the foot one. It's trying to isolate very small little muscles to do very unique things. And all of this is really to help with your reactions so that we don't drop things, with your grip. It just is isolating some very small muscles, which is why it's a bit harder. And then the final thing that you can do, and actually in addition to the exercises, this is incredibly important. But basically the nature of our nerves is we want to try and stimulate them. So in addition to doing the exercises, what you want to do is try and not necessarily irritate, but activate the nerves to your hands and feet as often as you can. And as I said before, our nerves have different receptors. So you need to mix and match, or otherwise you may find that there's certain textures or sensations that still are awkward later on. For example, I have patients where they work really, really hard, get improvements, and then they tell me they go to a beach, walk on it, and go, oh my God, that felt horrendous. And it's because we haven't dealt with those certain sensory kind of feedback that you might get from sand. So I'm not saying you need to bring sand into your house, but you just need to mix and match. So what I encourage you to do is, again, little and often. If you could do something every hour, amazing, but at least 4 times a day. You just want to stimulate your hands and feet with different temperatures, textures and sensations. And in all honesty, the weirder, the better. It's quite good to do things so like gently scratching your hands with your nails, maybe getting something warm and cold that you can use throughout the day. I really like things like deep heat, as long as it doesn't irritate your skin, because it leaves a sensation for a good kind of 20-30 minutes. Similarly, things that like mentholy do exactly the same, but as long as it's not too irritable. Again, we're activating, not irritating. Different textures, so a feather, a soft toy, something rough, something sharp. Really mix and match so that your nervous system doesn't then overreact later on when you get exposed to something that's a little bit different with regards to texture. And then finally, it is about making sure you add in the balance. So that heel raise without holding on is a good place to start, but also can you stand with one foot in front of the other whilst doing your teeth? Or can you stand on one leg whilst the kettle's boiling? Because you'll be surprised how impactful having nerve damage is on your balance, and you may not notice it at the time, but later on you will notice it. So get on it as early as possible. So will this issue resolve? And in truth, I can't give you that answer because everyone is a unique individual. What we do know is that most people do get resolution, but it can take months. When people follow the advice really rigorously, a lot of people find the first 4 to 6 weeks, they do see at least a 30% improvement, which is a good place to start. But you do have to try and make your body treat it like it's a brand new injury, especially if you're someone who's had this for a while. Your body has been so used to it, we need to trick it into thinking, hang on, we need to address it, we need to work on it. So I can't stress enough, be rigorous and you'll thank yourself. If you are on active treatment, so I'm talking about cancer treatment specifically here, so the drug therapies, chemotherapy, immunotherapy, targeted therapy, I'm going to be honest with you, your symptoms will not significantly improve until you finish that treatment. And it's just because your body is continually getting exposed by the very thing that's damaging the nerves. So we can slow it down and we can try and improve it very, very slightly. But in all honesty, the best thing is to chat with your doctors, chat about your symptoms and see what can we do to make sure this doesn't get worse. Is it lowering the dose? Is it spreading the sessions out a little bit? Or is it prescribing some type of medication that targets the nerve to calm it down? And that's a conversation you'll have to have with your doctor. But generally speaking, the vast majority of people, if it is a short-term neuropathy, it will resolve. But if you've had this for a long time, it may be that we can get it better, but we can't fix it. And it's just important to bear that in mind. My general advice is follow the advice, try the exercises for a good 2 months, so 6 to 8 weeks. If you see no change at all, then the chances are it may not change. Then you can go, okay, well, this is just me. But if you see improvements, albeit small, keep at it, because the body is a really wonderful thing. It's quite mysterious, and sometimes it can take a long time for your body to go, okay, I know what I need to do. I've seen it many, many times, even with things like fractures where the bone hasn't healed for months and months and months, and they're getting all frustrated, and then suddenly something clicks and it starts healing. And it's very much the same with all our body structures. It might just randomly start kicking in at some point. And then when we look at medical advice, so again, everyone is so unique. We can only give out general information online, but my advice is just be open and honest with doctors. Tell them how much it's affecting you, what type of symptoms that you're getting, because there are sometimes things that can be prescribed. There are nerve-specific pain relievers, not pain relievers, but nerve-targeted drugs that can help with your symptoms. Now, these drugs are not things that are supposed to be taken long term, but they're things that can just allow you to do more, particularly if your nerves are very sensitive and it's causing you pain or keeping you awake at night. I would encourage you to have that conversation, at least to bridge the gap so that you can do more. The long and short of it is your body needs to provide as much oxygen and blood as possible to allow those nerves to calm down. So it's trying to do whatever we can to increase that blood flow. I hope you guys have found the video useful. Let me know in the comments below if there's anything in particular that you'd like me to cover in the future, and leave a like if you have found it beneficial. Hope to see you soon. Thanks for watching. Bye.